listeners, thanks for tuning into The Spark, Medical Education for Curious Minds, where we present the people and stories behind medical advances at UCSF, including those led by medical students, physicians, and faculty in the School of Medicine. Through The Spark, we share the innovations at UCSF that are helping bring more equitable and better care to our communities. I'm Karen Fleming, Communications Manager for the Office of Medical Education.
And I'm Greg Gadwood, Instructional Designer for the Technology Enhanced Education team.
In this episode, we feature UCSF initiatives and research aimed at caring for people with sleep disorders. We'll hear from Dr. David Claman, a sleep disorders specialist who directs the UCSF Sleep Disorders Center. Dr. Claman discusses advances in research and treatment for Bay Area residents struggling with disorders such as sleep apnea and breathing difficulties. We also talked to fourth-year medical student Daniel Schwartz, who completed a research project in this area as part of his learning in the Bridges curriculum. So I'm here with Dr. David Claman, and he is director of UCSF Sleep Disorders Clinic. He's also a professor of medicine, and we're speaking to his work in sleep disorders today. So Dr. Claman, could you tell me a little bit about the burden of sleep disorders in general in North America?
In a range of different areas, the burden of sleep disorders in society is high because sleep disorders are so common. What's a challenge for us is that for any one individual, the impact of their particular sleep disorder may be low or high to them. So that part is variable. I often like to say that sleep is such a universal experience that everyone can relate to it in different ways. And everyone knows that at times sleep isn't going to be perfect, and we accept that. But if someone has persistent problems that interrupt their sleep, then it's going to have much more of an impact on them.
Let's take a step back for a minute and put this in context. How common are sleep disorders, and why is it important to initiate treatment strategies, especially for people with other related health concerns?
Well, according to recent statistics, about 1/3 of U.S. adults report inadequate amounts of sleep. Not getting enough sleep is linked with many chronic diseases and conditions, such as diabetes, heart disease, obesity, and depression, that threaten our nation's health. To hear more on the importance of treating people with comorbid or related conditions, let's hear from Dr. Claman. And what do we know about the underlying causes of common sleep disorders?
Well, that's a complicated question because there's such a range of sleep disorders. I would briefly say that the four more common sleep disorders we have are obstructive sleep apnea, insomnia, restless leg syndrome, and narcolepsy, and occasional patients with central sleep apnea. So you can imagine the factors in each area would be different. In obstructive sleep apnea, the most common measurable risk factor is obesity, but sleep apnea can occur in thinner patients, and often we get interested in the anatomy of the airway, whether it's enlarged tonsils or loose tissue that could be blocking the airway. So there's a range of different causes of obstructive sleep apnea. In insomnia, a lot of it, assuming that it's not from a physical problem, insomnia is often caused from stress, worry, and tension. And people fall into different bad sleeping habits and get what I would call psychological negative conditioning related to sleeping. And so there's a range of different factors depending on stress level, personality type, and ingesting caffeine and alcohol that can all be contributing factors. And so we often focus on behavioral treatments to try and help. One of the nice advances recently in insomnia is having people be more aware that cognitive behavioral therapy for insomnia, which is a multimodality treatment approach, can often be helpful. And in recent years, the pendulum has very much swung away from giving sleep medications. The third area I'll mention briefly is restless leg syndrome, which can run in families. We haven't identified a genetic cause yet, but iron deficiency can certainly be a contributing factor. So restless legs is often more common in women because of the risk for iron deficiency. And then narcolepsy is one of our very prototypical sleep disorders, and generally is felt to be caused by a neurotransmitter deficiency in the CSF and the central nervous system.
So you mentioned cognitive behavioral therapy as well as some medication-based treatments. What do you see as some of the other most promising advances in managing and treating common sleep disorders?
Well, I think that some of the more recent advances that I think will be helpful to us for obstructive sleep apnea, the fact that the CPAP equipment is smaller, quieter, and the masks are more comfortable, I think has made CPAP work better for more people, but it's still a challenging treatment. And it's nice that dental appliances are a realistic option for many people with milder degrees of obstructive sleep apnea. One of the more interesting areas physiologically that came up recently is interest in a nerve stimulator treatment that's been developed by otolaryngology. So there's an implantable nerve stimulator that can be given to stimulate the hypoglossal nerve unilaterally. It's generally just done on the right side in one nerve to see if making the airway muscle contract more forcefully could keep the airway more open. It's a very highly selected group of patients who failed CPAP that might be a candidate. But from a point of view of causation, what's interesting about the nerve stimulator is it gives us insight into a potential different mechanism of disease, underactive airway dilating muscles, and a potential intervention that might be helpful.
And in your own work and research in this area, what have you found to be the most surprising lately?
A lot of the treatments that we look at have been around for a while. I think one of the most pleasing to me is the accumulating evidence that CBT and using cognitive behavioral therapy to treat insomnia really can be quite helpful. And it's given more patients hope that they might be able to find ways to sleep better, either with no medicine or less medicine.
Speaking about medical students that might be interested in this area of work, what would you say to a UCSF medical student interested in specializing in sleep disorders?
If you spend the time to get a sleep history looking at snoring, apnea, daytime napping, insomnia symptoms, waking up at night, leg restlessness, use of caffeine and alcohol as some of the basic questions, it's a very interesting area because you'll often uncover different problems that people have. And one of the biggest issues with sleep disorders is that people don't take a history or think that all sleep disorders are one issue. And so using a more common sense and intelligent approach to it, taking a sleep history is a wonderful first step.
What are you most excited about for the next phase of your research or work?
Well, I think two areas are particularly exciting to me right now. One is the improvements that we've made in CPAP. I think that obstructive sleep apnea is so common that the more patients that we can treat effectively with CPAP, the better off we are, just because it can be such a highly effective treatment. The challenge is that not everyone likes it, and the truth is that it's a hard treatment to use because you have to wear it for 6 or more hours per night, which is a lot of work for any person to do. And so I'm hoping that we'll become more sophisticated and accurate at predicting which patients will really use it and benefit. But I think the improvements in CPAP are particularly exciting. And the second area, just to reiterate about cognitive behavioral therapy for insomnia, I think right now there's not as much access to those treatments in many ways because they're provided by psychologists, And getting CBT is generally an out-of-pocket expense for the vast majority of patients. So not everyone wants to invest in cognitive behavioral therapy by seeing a psychologist, but I'm hoping that that'll become a more and more common treatment for people over the coming years.
Now that we've heard from Dr. Claman about his work to discover improved ways to treat and manage people with sleep disorders, let's hear from fourth-year medical student Daniel about how elements of the Bridges curriculum are helping learners prepare to care for people with these common health concerns in the Bay Area. Can you please tell me what sparked your interest in sleep disorders?
My interest in sleep came about sort of early on in medical school. I had been just reading, I think, in a broad sense, and sleep sparked my interest because it's really at the intersection of a lot of really interesting areas within healthcare, including the impact of sleep on memory, mood, cognition, and its effect on mental health, and then from heart disease to hypertension, arrhythmias. And it's really a ubiquitous problem that is probably very understudied and underappreciated at this point. I was working with Paul Blanc, who's an epidemiologist and a pulmonologist here at UCSF, and Dennis Vinikoff, who's lives in Kazakhstan, but he's actually was a researcher at UC Berkeley and did his postdoc work there in epidemiology. But we were interested in the prevalence of sleep apnea among a couple of groups. So we were looking at commercial drivers, broadly defined. We were looking at patients who were exposed to organic solvents in their workplace. And then we had this broad kind of other category that included a number of different occupations. And so the project was a meta-analysis, so kind of dredging the literature and using statistical methods to really hone in on the prevalence of sleep apnea and then the risk associated with different exposures in the workplace, namely organic solvents.
What aspects of the curriculum especially prepared you to potentially treat patients with sleep disorders?
Well, I had more of a unique path. I did the joint medical program at Berkeley, so I spent the first 2 to 3 years at Berkeley actually studying biostatistics and epidemiology, and it was there that I had a professor, Craig Steinmaus, who introduced me to meta-analysis, and I think the sort of the power of meta-analysis is the ability to really look at conflicting data and look across 10, 20, 30 years of research and to try to make sense of conflicting data that can be interpreted in different ways depending on how you read the papers. So that was the part of my curriculum that kind of led me to this project, which I think is probably a little bit different than the usual curriculum, because I had this extra year where I was taking courses and studying statistics.
What aspect of your future training are you most excited about, and do you plan to incorporate this learning about sleep disorders into your career path?
Well, I'm definitely interested in the impact of sleep and the brain and cognition and mood. I'm really interested in neurology and psychiatry, and so I think this is a project that was more epidemiology based, but that fits into a lot of medical problems that arise in the clinic, and that as we see the sleep medicine field kind of expand to include a broader range of fields from psychiatry to neurology to pulmonology, I think there's going to be more of a space there, assuming I go into a neurology program to kind of explore the sleep dimension.
My last question, and a more informal one, I imagine your sleep as a medical student is sometimes compromised. How do you practice good sleep hygiene yourself?
Well, I don't, but I don't know that this project I necessarily gleaned any good sleep habits. In fact, it probably was detrimental to my sleep. But I think, I just try to turn things off at a certain point. So, maybe like an hour before bed, I'll try to read or just do something kind of chill, and not stress out about the next day or anything else to the best of my ability.
So that's really interesting that he's talking about these different modalities, such as mindfulness or cognitive behavioral therapy. I mean, where mindfulness could involve meditation or some other practices to just sort of take you in a different direction, because I don't think that that's terribly common in medicine to acknowledge and explore these topics maybe. I myself have struggled with insomnia before, so I find this really interesting. What about you? What do you think?
Yeah, it's inspiring to see that faculty such as Dr. Claman and others at UCSF are looking at approved and long-standing methods of treating sleep disorders, as well as some of the more cutting-edge advances such as mindfulness and cognitive behavioral therapy. So be sure to tune into our next episode, in which we feature initiatives aimed at diversity, equity, and inclusion in the School of Medicine.
The music in this podcast comes from Poddington Bear's Egress, licensed under CC BY NC 3.0, and available at the Internet Archive.